Good afternoon. My name is Wanjiru Chegi, and today I will be presenting on the case of Gray, who deals with a Xanax use disorder. Um, this presentation will examine Gray's Xanax misuse, focusing on assessment, diagnosis, treatment, and ethical care. Also, culturally responsive care. Basically, Gray is a 33-year-old non-binary client referred by their partner. They initially report and present with depression, but later through talking to the client, they disclosed that they had unprescribed Xanax use, which they have been taking from their partner who does not know. This indicates hidden substance misuse and possible dependence, which is consistent with the DSM-5 and the substance-related disorders. The referral from their partner also suggests relationship strain and concern for their mental health. For presenting concerns, Gray shows co-occurring depression and substance misuse, which often interacts and worsens outcomes. There's also, again, relationship strain and limited insight because Gray does not want to acknowledge that the Xanax is of any concern. The unwillingness to acknowledge the substance misuse. These factors complicate treatment and require careful assessment. Once again, for substance use, Gray reports using Xanax obtained from their partner without a prescription. And this pattern basically reflects self-medication to cope with emotional distress. Benzodiazepines like Xanax carry a very high risk of dependence and withdrawal. The diagnosis for Gray, Gray meets the criteria for sedative, hypnotic, or anxiolytic use disorder based on the DSM-5 criteria. Depression is also present, and that requires a bit of further evaluation to see how severe the depression is. And the co-occurring conditions must be treated together for this treatment to be effective. Co-occurring depression is, as a dual diagnosis, is common in many substance abuse cases. The assessment tools that I used were the TAPS tool to assess substance use severity, the PHQ-9, which helps measure depression, and the CSSRS, which evaluates suicide risk. These tools pretty much assess all the outstanding issues that have presented themselves, providing a full clinical picture of Gray. The risk factors, Gray faces risk of withdrawal, overdose, and possible suicide. Benzodiazepine withdrawal can be medically dangerous, so safety planning is essential. The risk of overdose and potential suicide are actually due to the co-occurring depression. The level of care. Gray requires a level of care that's considered the IOP, which would be an intensive outpatient program. And it's appropriate based on the ASAM criteria, which balances structure with independence. Given Gray's functioning and risk level, intensive outpatient treatment with detoxification support is the most appropriate level of care. This approach provides structured treatment while allowing continued engagement in daily life. And detoxification support is necessary due to the risk associated with Xanax withdrawal. Gray does not require inpatient care, but needs more support than standard outpatient services. Um, they demonstrate, Gray demonstrates moderate severity, which does not require inpatient hospitalization. And Gray also maintains daily responsibilities, which supports outpatient care. Cognitive behavioral therapy is the best and most effective treatment approach, and also relapse prevention strategies are effective for addressing both substance use and mood symptoms. CBT targets the maladaptive thoughts, while relapse prevention builds coping skills. And psychoeducation increases awareness of substance use effects. The cultural considerations in this case deal with Gray's non binary identity. Um, they're critical in this case because Gray's non binary identity may contribute to binary stress, and they also may deal with barriers to care. Affirming inclusive counseling practices are necessary to build trust and to support engagement. Minority stress can increase vulnerability to substance use. Once again, counselors must provide affirming and inclusive care to support engagement and trust in the counselor. On the ethical side, the ethical practice ensures safety, trust, and legal compliance. Ethical practice includes maintaining confidentiality, obtaining informed consent, and addressing safety risk when necessary. Um, these standards basically guide the clinical decision making. Ethical responsibilities also address duty to warn when necessary. And different states maintain different standards, but the state that I'm in, North Carolina, they do maintain a duty to warn. So that would be one of the ethical issues dealt with in Gray's case. Collaboration with medical and mental health professionals strengthens the treatment outcomes and continuity of care. Since Gray has co occurring depression and Xanax misuse, this is especially beneficial for them. Um, Collaboration with medical providers supports safe detoxification, especially for benzodiazepine withdrawal, which can require medical monitoring. Psychiatrists may assist with medication management to address both substance use and co occurring mental health symptoms. And coordinated care improves treatment outcomes and supports long term recovery by ensuring continuity across providers. The treatment goals should be measurable and address both substance use and mental health. So the treatment goals in this case include reducing the Xanax use, improving mood stability, and developing coping skills that replace substance use behaviors. The goals should be measurable and tailored to Gray's needs to support engagement and progress in treatment. And therefore, the treatment goals would be put together with Gray so Gray can have input as to what would work best for them. Addressing both substance use and depression is essential for effective treatment of co occurring disorders. Overall, Gray's case highlights the importance of integrated, culturally responsive, and ethically grounded counseling practice. Um, Intensive outpatient care with CBT is appropriate based on Gray's level of functioning and clinical needs. And again, the effectiveness would come from treating both the substance use disorder and the mood disorder. That concludes my presentation. Thank you.